be happy to discuss partnerships, add value to your organization with consulting, or discuss any needs that you might have in the staffing space.
Like,
thanks, Craig.
Doctor? What? Oh, sorry.
We're going to ask you to, if you can mute your microphones while we go through the presentation. Thanks, Kim, for giving an overview of Wapiti medical staffing and all the services you provide. As we dive into this, I'm going to go through the presentation and a little bit more about us, and then show you some examples and use cases we've done. So about H4 Technology, we're based in Omaha, Nebraska. We're founded in 2012, 25 years of healthcare experience, and we have a variety of solutions for a couple different markets. So we work with critical access hospitals. We work with hospital associations. We're the data management provider for Nebraska Hospital Association and have a partnership with Indiana. As well as we've built out some unique things for ACOs and behavioral health sector. We're in, I think that's 8 states and growing now, with partnerships and other clients across the U.S. And it has been an exciting time. I know COVID has put a strain and struggle on a lot of organizations, and we've felt that last summer, and with the fall and the vaccines coming out, I think business and hopefully you guys are picking up patient volumes and seeing things come back to new normal, I guess. When we're looking at what we offer in our Compass data management suite, we have claims data management. So we're going to talk about claims denial management, reconciliation, aging intelligence. We also do revenue intelligence and financial intelligence. And so a new piece that we're launching is the ability to integrate with financial systems for revenue and other metrics for CFOs. And then the bottom piece is quality metrics. And so this is looking at core measures, KPIs, outcome measurements. We have a SDOH platform and assessment tools that can be all incorporate or all encompassing of this data. Today, we're going to talk about claims data management and the use cases for that. This was a rev cycle management slide I borrowed from Julianne Kipple at Lutz. And I thought this, summed up what you guys go through. So as you can see, the hurdles and pitfalls that you have to go through to actually file a claim and get a claim paid, across the finishing line. What we're seeing as we look at the claims and impact on claim denials to your business is, the average denial rate in the U.S. is around 10%. We see a higher percentage of Medicaid funded populations. Average denied claim was around $1,100 last year. And then denied claims are taking, 16 days longer to pay. Providers, spend roughly $118 per claim on the appeals process. And then patient satisfaction. Sometimes the denied claims and ability to get things processed might be seen as a negative with a facility, right? And so it could lead to patients seeking care if you're in a competitive environment. So you want to take care of the patient satisfaction and the patient during this whole process. As we talk about denials, what is a denial? It's a decline of payment from a payer when it's expected. There's a variety of denials out there. So there's hard denials versus soft denials, preventable denials, clinical denials, administrative denials, lack of coverage as a denial. And then an interesting article I found on HFMA was about the silent denials. So we'll talk briefly about that. Typical, top 10 denials that most organizations run into are duplicate claims process. Maybe there's a coordination of benefits issue. medical documentation or lack of medical documentation. We always look at timely filing limits, authorization or pre-authorization of services. Maybe there's a referral component. Eligibility and verification are common ones, as well as the charge exceeds fee schedule. And we've seen a lot more of those actually recently. Modifier issues and medical necessity. And so as you're looking through the denials, these are the most common ones that nationwide people are seeing. What we see within our claims process is a lot of denials that are either duplicates or they are lacking information and could be prevented or get passed through the first time. So you can see 22%, an exact duplicate claim going out. 19% where claim lacks service or information. And then on down the list. So charge exceeds fee schedule, 15%. Plan procedures were not followed is 9%. And then services not documented in patient medical record, 7%. And then it tends to all, there's a variety of these at like the 1.5%, 2%. Timely filing limits, prior authorization, eligibility and verification. But as you're looking at that, 2% adds up pretty quickly over a variety of your claims, and of course over the year. So process improvement methods. So, when what we see is, we should identify the top denials by payer. You should analyze, your past 60 to 180 days worth of claims, set some baseline metrics of that, and then you can isolate those claims into different buckets to identify and tackle things. A lot of times it can be overwhelming to take on maybe a claims review process, but if there's a specific issue with procedure or a documentation issue, let's just identify those easy wins and bucket those so that you guys can process that and walk through the process and get some easy wins under your belt. That keeps the staff motivated and keeps the momentum going for the project or the claims cleanup project. Sometimes, I think just in life and in other projects, cutting that big chunk down into segments and then tackling those each day, each week can help out. And then what we look at or see is we want people to drill down into the denials. So there's CART codes and remark codes. So remark codes provide more detail and clarification on the denial reasons. And so you want to understand why these are being denied and the reason codes for that. And then is it the same across payers or is it different by provider? And what are the denials for you? I referenced that X12 resource, and I just wanted to pull this up. So this is x12.org/codes, and this is a code list for, if you aren't familiar with these guys, for your CARC and RARC codes. So you can come in here on x12.org, filter, look at the claim adjustment reason codes, and then I can look at what my denial is, filter by the code. So maybe I want to look at 16s, and then that's as claims lack information or as billing submission errors, right? Same with if I go back here, the RARC codes. And so down here are the remittance advice for RARC codes. So these are additional codes that filter in on why the claims are being denied. So if you haven't seen this resource or looked at this, it's a public available piece for you guys. Okay, let me get back to PowerPoint. And with that search tool, it provides the definitions, or if you get some funky ones coming through that you want to research more, you can look in that. So process improvement side, we got ways to improve payer relations and contacts. Make sure you know who your payer representatives are, and then review the payer contracts each year to see, what is being paid and what the amount is on your top 20 or so services. Internally, you can review the registration process, look at any charge entry leakages, and then the final piece is claims reconciliation. And what claims are still outstanding, what claims have been paid throughout the year. Oh, got a mid Jill here. And then finally, there's tools from partners that can help this whole process. So there's claims editing tools, there's eligibility updates, there's contact management. Have edits that they can run, and we work with a variety of them. And then there's a business intelligence feature to help group and help you manage the denials or the claims process. When you're looking through the claims and going through a denial program, we should set measurable goals. So measure and review the data. Examples can include, clean claim rate, your CART code, denial rate percentage, if you're tracking that, overall denial rate, maybe days in AR. And then it's key to celebrate the success and, be a team at the organization. So create best practices, document those, document the wins, and provide a way for others to learn off what you might have found. This encourages, positive encouragement and just overall teamwork on the process. So that was the overall of what I had, put together, and then I'm going to go through some use cases of what we've seen. And then I've stumbled across this Becker's Healthcare CFO report. And so this was from November of 2020. And so the report was 86% of denials are potentially avoidable, right? And so strategies to prevent and manage those denials. And what they came across and what the summary of their report was, were these kind of 5 things. Half the denials are front-end rev cycle issues. The top cause for denial remains in registration and eligibility. So that equates back to some of the CART codes we saw. In their report, they had 26% of the denials analyzed, caused because of that registration and eligibility. This continues to shine a spotlight on the need for innovative solutions that drive greater intelligence, right, in the front end of the revenue cycle. The second key point was a denial prevention strategy can save time and money. Their cost was $25.20 per claim to rework a denial. It's always best to try to avoid the denial before it happens rather than try to recover what is owed. The third point was use of analytics to inform a denial strategy. And this is setting up a denial management or prevention strategy is an analyzing what you have. A provider should use the analytics to figure out where the denials are occurring, most frequent, and then the biggest impact, right? And so the fourth point was there are several reasons for the national uptick in denials. We've seen it, I think, locally, payers change the rules every year. And denials are increasingly across the US for some of it is, they claim expertise to manage the denials, lack of the denial prevention strategies, training, hiring and retaining top talent in those departments, and then the lack of optimized or automated workflow. So the fifth component or strategy was providers should address denials in 6 key areas. So that was eligibility and registration processes, authorizations and pre-certifications, medical necessity, medical coding, missing claims, and not covered services. And so this is from Becker's. You can see the link to the article there. I can send that out after the presentation, as well as if you want to go in and dive into that report. But across the, I guess, landscape, people are seeing these as a good percentage. So what I wanted to get into now is some examples of critical access hospitals we work with, and what can be done. So this is a sample, for a specific quarter. We had a CART code, they had 33% where charges are covered under a capitation agreement. 13.8 was patient cannot be identified as insured. And then 16 is where the claims lacks information or has or missing information. And so we just wanted to target those 16s. And so, there's $23,000 in that group. And then we could drill down into the actual remark codes for those. And so, what is going on with those claims? So 37% of those denials were because missing incomplete billing provider information. 27% was incomplete, invalid itemized bill statement. 14% were invalid national drug code. 6% referring provider number. So some of these can easily be remedied, and then you can put processes in place so they don't happen going forward. So the first step, is analyzing what's happened, in the past with, either that 60-day to 180-day window. And then the second piece is, okay, let's put some processes in place to move forward with that so they don't happen. So the total impact, of those 122 claims, claim rework cost, $118, let alone what gets, refiled. It's okay, here's the actual administrative cost, time from the facilities of what they're doing. So another piece is this process improvement template. And so what we have done by working with a variety of clients is, they'd come on our platform and we'd work with them and they wouldn't know where to start. And so we created a process improvement template, and there's one in the email or a link to the download that free template. And this helps you identify the top denials by service and by payer throughout your retroactive review. So the
I think it is dying. I just haven't got a new one.
The first piece is services not provided or authorized by designated PCP. So the use of this CART indicates that there is an issue with either a referral was required and not provided, a taxonomy code, or the services rendered being out of scope for a given provider. Additional information on this was the CART was deactivated in 2013 and replaced with 242 and 243. So another one of the top denials they had, regardless of payer, was charges are covered under a capitation agreement. And so this is the use of CART indicates that there are attributed patients for which fee-for-service claims were submitted in error, and there are patients for whom retroactive attribution was granted. So those are the remedies for those denials. The third part was the patient has not met the eligibility requirements. And so this the use of this CART code indicates that there's a breakdown in the eligibility verification process, or the patient failed to pay their premiums and coverage was retroactively terminated. And so through that intake process, you can verify the eligibility, the dates of the eligibility of insurance, and through there. So as we work through those top three payer agnostic, denial codes, we can assess internal processes for gaps and improvement. Specifically, what we called out the eligibility verification process. entry of demographic data and coordination of benefits, documentation of the services, and prior authorization of the services. And then, you can connect with the provider reps to confirm taxonomy numbers are accurate for each provider, discuss recurrent issues. Does Department of Social Service require a copy of the visit note, with all the claim submissions? So, and then this was one other thing we found was there are several duplicate payer names, considering a numbering schematic to properly crosswalk this report with the practice management system analysis. So there's multiple pairs names within the practice management system that were causing errors. So, then I mentioned earlier at the beginning of the presentation, there's something called silent denials. One of them is a CART code 50 medical necessity. And so this was a report that came out last fall on the silent denial process from HFMA. And silent denials are from a condition response and the utilization review. And so I can, once again, there's a whole report on this, but silent denials emerge from clinicians' condition behavior in the utilization review process. Such denials can be a consequence of actions or inactions by both case managers and physicians. So this is conditioned response to their job, to being, everyone's has more and more workload on them, to what they think is happening with the patient at the first pass. And so I'll send this out. It was an interesting report. And just we equated it back to that CART code 50 on medical necessity to review. So as we get into claim data management, what we specialize in is being the single source of truth for those data points. And by doing direct data integration with the clearinghouse, we're getting data right from the source of truth, right from the claims clearinghouse. And there's a variety of different data that you can get. So 837s, the claims being submitted, the 835s coming back from the payer, and then claims reference tables for the CARC and RARC descriptions, and then the claims reconciliation process. And so through this, we have some examples, of claim line reconciliation. So by analyzing both data sources, you have the ability to match the 835 back to the 837 to determine if all claims have been filed with a payer. Some systems have this. We obviously partner with groups to provide this benefit. And then there's a variety of partial denials versus full denials versus incomplete adjudication. And so you can look at by week, by date, by payer, by procedure, what's going on with your claims and what's still outstanding or what hasn't is incompletely adjudicated. So with the additional pieces on the denial portion, we have interactive dashboards with table details to filter by payer, procedure code, CARC descriptions, RARC descriptions, and then there's built-in monitoring use case tabs for missing, invalid, incomplete, missing, invalid, incomplete data from submitted, billed services not covered by the health plan, benefit for billed service not separately payable. And then when we worked with clients, we found that not all payers followed the rules. And so we created outliers tab. Typically this is Medicaid, social services, some outlying payers there that might not have as sophisticated systems or processes in place when they submit payment back out. And so these help define and show where there's gaps in or opportunities, I guess, in the billing process. Like I said earlier, the process improvement template, it's a standard Word PDF document. What we recommend, and this is what we do with any new client, is looking at the top 3 denials by payer. So your top 3 payers, your top 3 denials, and then putting a plan in place on those denials on how to review either the denied services, or looking at the process and procedure behind each one of those. So generally, we would quantify that percentage of denial and look at the total dollar revenue and help people out. As you jump into denials, I think looking at the largest ones, the largest buckets first, and seeing how you can whittle those down, obviously give you the biggest bang for your buck. So, or time. So some of the other reviews and things is, doing that during the documentation and check-in process should be reviewed for improvement. Documentation claims entry should be analyzed. These type of things should have been caught by the clearinghouse. A lot of times you can go back to your clearinghouse for edits on the claims as they're going out. And we've worked with a handful of them that have, that have those edits, that are client specific because of their unique circumstances and billing. So, additionally, we provide access to data to help answer questions, summarize or maybe claims. And so, do you have access to the 835 data within your, or 837 data within your practice management system? I'm going to try and get Amber in here real quick. And then on that data, we've done a variety of one-off requests. They're just they know they have an issue on this certain payer with this certain denial code, but they wanted to go retroactively back and see what the total impact is for, let's say, 2020. And so we can create those on the fly with access to your data and provide analysis on that. So new things that we're doing are grouping the claims into H-child balance buckets. And so this helps providers with cash flow by analyzing the days it takes for a payer to pay the claims. And so we got 2 charts on those, days from service date to claim date and days from claim date to payment date. So the first one is days from service date to claim date. So we're trying to analyze and see if maybe there's an internal process that's going on to actually get that claim out the door, right? So from the service date to the actual claim, when that claim drops. And so those can be filtered by time frame, by payer. They're grouped and summarized down below so you can see different totals. And then on the right is, okay, we're actually analyzing days from a claim date to payment date. So how long is it taking the payer to actually pay those type of claims? And so there's interactive buckets, to look at the 30, 60, 90, over 90-day buckets. And then you can compare payers and just arm yourself as you go and talk to your payer relations people. What can be done. So if you know that, Blue Cross or Aetna or someone Humana is paying, has more total dollars in the, 60 to 90-day bucket or is taking longer to pay, then we can dive into that data and detail to help arm you guys as you negotiate. So, this is just an example of that. We filtered off the 7, anything below 30 days. So you can look at the change. So you see how that bucket changed down to this bucket here on that Blue Cross Blue Shield. Additionally, All these has the ability to filter by time frame, by payer, by procedure code, and then the payers are rolled up into buckets. So a lot of times you might get back on the claim. Blue Cross Blue Shield might be BCBS, BCBS-NE, Blue Cross. It just depends on the system that's going through and the way it comes back. So sometimes grouping those, if you don't have a system to do it, could take you a long time if you're manually doing that. So, or just selecting multiples. Additionally, there's trending information for outstanding receivables. So days from service date to claim date, days from claim date to payment date. And then you can kind of look at that over time, see what your receivables tracking and trending. And then we launched, this is new as of November, I believe, revenue cycle metrics to help people out with patient services billed revenue, patient service payment, payers rolled as a total adjustments as a percent of the billed charges, and average days in the AR. With the data, then we can compare 2019 to 2020, see if you're improving or areas of opportunities to improve, and then look at the total days in AR and payment dollars and percentages and everything. So, okay. So, where we're headed and what we're doing, we keep adding, like I said, more and more to this platform and share it across all our clients. So we keep adding tabs to it. We got a couple groups that are trying out payer fee schedule now, did payment versus actual, or loading the top, 80-90% of their codes for revenue, and then comparing that to what actually got paid. We'll keep looking at the charges, payments, and adjustment trends and expanding that. We're looking at clean claim rates as they're getting processed through versus the denials. So what gets processed first try through the system. We're looking at per visit value calculation, and then comparing across our client base denial rates. Maybe it's a state specific, maybe it's a federal, or maybe it's a specific market. And so those are all things we're looking at adding and bringing on as we get more and more use and use cases out of the tool. So, okay. So once again, we do this claims data management to help improve productivity and cash flow through the use of technology. Like I said, we can bring on the claims data with a direct connection to a clearinghouse. We already have 15 clearinghouses established connections, so more than likely we have something, depending on where you're at. Or we can work with your IT team to pull in a flat file. So it just depends on your setup. We load that data and then provide a no-cost assessment by our in-house rev cycle executive. And so they'll go through, look at that template, fill out that template, make recommendations on the top 3 denials by payer, and then provide recommendations on those denial codes. And then we also launched that age trial balance thing or dashboard. So you can look at the denials and look at the time it's taking on another tab for payment from providers or payment from payers. So, okay, that's in total, what we're doing. I recorded this webinar and we'll go into just a brief showcase of what we have on the system, just to show you how what we're doing. And then I recorded it and I'll send out the links. And once again, that process improvement template. This is our denial demo platform. So you can see the full window here. We'll reload. And then we'll go through a couple sample use cases on the platform, and then you can see, if there's any interest in learning more, we'll provide our information. So when you launch the dashboard analytics, we bring up the denials, and so it's the denial overview. So here's where you can actually see by week what's happening with your denials. You see a total claim line, total amount. And then you can see your payer mix. We always have the ability to filter those data and elements. And so you can look at specific payers, specific providers, DRG codes, CART codes, RART codes, procedure codes. And then if you're in maybe a net health network or a health system, you could actually do different clients if there's different data feeds coming to us, just depending on what you're doing. So on the bottom, you can see here, you can hover over and interact with this. Okay, I have, these payers for that date range. These are the amounts. We just got some sample data in here. And then here's where I could look at the CART and RART codes. And so we built into the platform the CART descriptions and reference tables for, so CART code 45 here, the full CART descriptions charge exceeds fee schedule and maximal allowance or the contracted fee arrangement. So you'd want to look at the contracted rate for that payer is and what you're charging. And then here's where we dive into the RARCs. So I can pull up a 45 and then, look at what else is, it's not covered when it's considered preventative, patient ineligible for this service, consult plan benefit documentations for any restrictions for this service. Additionally, at the bottom then, we could filter on any of this, and then we provide, patient control numbers, and we go top down for the biggest claim that's denied. So you can always start with the largest one. And then the key component is that we're actually drilling down into the claim line detail. And so when we're looking at the data that's loaded, and what that creates the charts, I can, filter by a time frame, I could filter by a payer, I could filter by a specific CARC or description code, and then I always have access to the detail of those claims. And so when I click that little Excel export icon, I can look at by claim line what actually is happening with this payer, what is my charge amount, my adjustment amounts, the CART descriptions, maybe there's a modifier issue on this. And so what we're finding is people using this to create basically their working queue on, okay, here's my payer, I'm going to filter by my payer, here's my top CART description, and then I want to export those and go research what's going on with those claims. So additionally, you'll see the different tabs, so you can see the use cases. So this is invalid, incomplete data that when it was actually submitted. So I can click on that. I can look at billed services not covered by health plan, the defaults to the specific quarter, and then I can also look at whether the benefit for the billed service not separate payable outliers, and then I also have an approved claims. So these are the actual claims actually processed, didn't get denied, got pushed through and paid, and so I can filter by payer, by procedure, and give it a second, and then it'll load. So maybe you're looking at, okay, what the total amount of claims for a specific procedure amount or for a specific payer was over a time frame. I can easily look at that and analyze those things. So, okay. All right, so we'll just, I think on that note, I'll showcase, we can showcase some of the other pieces, but we're coming up on time. I wanted to, I'm recording the presentation as well as we'll provide the links to the documentation and the free process improvement template on the top 3 denials that you guys can use and take back to your facilities. And then if there's any questions, please ask. So, okay, here's a couple. So how do we incorporate into the existing provider softwares, or does the communicate to pull all this data? So like I said, we'll go directly to the clearinghouse or wherever the claims data is loaded at your process or at your practice management system, get a copy of that, load that to this denials management platform, and then we can analyze the denials. Paper claims, that's always a tricky one. If you can get a copy of a file, we have a paper claims file to load to add to this platform. The automated way would be to actually integrate with the practice management system. But we do have a process to load those paper claims. As you know, you guys know, it's kind of a, if it's paper and not electronic, it's gonna, we got to get an electronic format so that we can load it here. So, okay. Any other questions? Let's see. Okay. Well, with that, I am, once again, my name is Craig Christensen with H4 Technology. I will put my contact here. If you want to reach out, have any questions, maybe there's a specific system you're asking about integrating with, you know, feel free to reach out to me, or how this could be implemented at your facility. We are hosting a webinar series, and so we are pushing out content. We're going to cover the specific reconciliation process, dive into the nuts and bolts of that on our next webinar, which is set for, I believe, the 5th of March. And so I'll make sure to send that out to you guys so that everyone can keep learning. With that, I will give you a few minutes back to your day and hope everyone has a good Wednesday and stays warm. So thank you.